Bipolar disorder is a highly complex illness, and so when a provider asks, "How have you been doing since we last met?" patients have a limited amount of time to report on everything that's been going on. Moods can be up or down, patients can have anxiety, problems sleeping, side effects from medications, medical problems, family or work difficulties, or stress from their environment. Measurement-based care is a method to systematically administer symptom rating scales to help gather and organize important information about a patient's symptoms. It can help both patients and providers avoid what are called errors of omission, that is, forgetting to ask about or report on important symptoms. With the information gathered by measurement-based care, the provider and patient can use the results to help make decisions about treatment, so it can help with what we call a collaborative care model of treatment. Using measurement-based care helps improve the efficiency and thoroughness of an appointment, since much of the information is gathered before the appointment begins. And studies have shown that patients have found using scales and measures to be highly acceptable. So measurement-based care can help take all of these disparate symptoms and organize them into something more meaningful for both the patient and provider. In this instance, we can use a routine depression scale, the Patient Health Questionnaire 9, and ask the patient to rate their symptoms over the last 2 weeks. In this case, a score of 17 reveals that the patient has been suffering from a moderate level of depression. Even more helpful, we can get a better sense of the movement of scores in relation to treatment. And if we use a few more commonly used scales, in this case the GAD-7, which rates anxiety, and the Altman Mania Scale, which rates mania, we can quickly get a better sense of what's happening with this patient's mood and anxiety symptoms between appointments. We know that measurement-based care improves outcomes for patients from many studies, true not only for patients taking medications, but also for patients receiving psychotherapy. We also know that proper use of measurement-based care involves using repeated measures, rather than just checking 1 or 2 times. The use of measurement-based care helps patients more fully understand their disorder and get a better handle on early warning signs of relapse or recurrence into either mania or depression, and ultimately allows patients to communicate more effectively with their providers. Just some final thoughts on the use of measurement-based care in clinical practice. It's easy for patients to use scales on their phones, or clinicians can often send scales to patients to fill out through electronic health records. This can happen before appointments, which helps improve the efficiency and effectiveness of appointments. Overall, the use of measurement-based care in clinical practice increases the probability of patients getting better and is well worth using.